Well, healthcare debates in South Africa tend to orbit the big ticket issues, things like NHI, medical scheme affordability, hospital capacity, medical costs, and the widening divide between public and private care. But beneath all of that, I think sits a far more human and arguably more urgent constraint: the people who actually keep the system running. The doctors and nurses and administrators and claims teams, the care coordinators and specialists are under rising pressure. Burnout is no longer just a soft human resources issue. It is becoming a hard operational risk. Well, that's certainly according to Kevin Aron, Principal Officer at Medshield Medical Scheme, who argues that workforce sustainability must now be treated as one of the core healthcare issues in the country. So, Kevin, welcome back to the show. When we hear the word burnout, it can often sound like an individual failing and someone not coping or not resilient enough or needing time off. But your argument is that burnout is really a systems failure. What do you mean by that?
Yeah, thanks, Michael, and thanks for being on your show again. Burnout occurs across many aspects of the healthcare spectrum, and I'll sort of explain that. But if you just start in the public healthcare sector, and it's actually, I would argue, not even defined purely to the healthcare sector in the public sector, but even the private sector is, we know that there's a scarce shortage of nurses. And, they operate under very, very tough conditions, especially in the public sector where the facilities are completely inappropriate in most instances. And, they're trying their best to do what they actually want to do, which is to care for patients. But the external factors and the internal factors in which they operate are often very difficult. And especially if there's, under-resourcing, lack of support, lack of infrastructure in terms of what they need to do their job, it becomes very challenging because you're dealing with health. You're dealing with people who need care. And, what we see is that there's very high rates of burnout. And, this burnout leads to, it's not just, anxiety, depression, but it also manifests itself in absenteeism, and that then has further repercussions because your resources, which are already not sufficient, are even less, and the people who are in the hospital or in the healthcare facilities are now forced to take up that slack, which creates even more pressure and stress for them. We know that there's a shortage of skilled nurses in particular. A lot of our nurses have emigrated and taken up options in the East and Dubai, the Emirates. So this is a systemic failure that needs to be addressed. But interestingly enough, it's not just linked to nurses dealing in the public or private sector. I mean, I see it even in our own environment where we have nurses and we have other skilled resources operating in call center environments in healthcare. And, medical aid for most people is a necessity, but it's a grudge purchase. So, when you phone your medical aid, typically you're not phoning to thank them. You're phoning because you're unhappy about something. So these resources are also operating under huge amounts of stress, having to deal with high volumes of calls, irate members, people not understanding often why the medical aid is not paying for something, even if it's not within the rules. And, we see even within our own business that, there's very high levels of stress. There is burnout. And again, we see high levels of attrition and absenteeism, which we have to try to deal with as well. So it's a systemic problem.
And it's interesting on the nursing front, Kevin, ahead of National Nursing Day a couple of weeks ago, I think it was, I was actually chatting to one of the head nurses at Life Healthcare. And we really set up our nursing profession to fail through no fault of their own because of the way government qualification policy changed. So often these crises are self-induced.
No, no, they are. And I mean, we can go back and talk about so many things when they closed down the nursing centers, when they haven't, addressed the resourcing requirements appropriately in terms of the number of staff that you actually need, giving them the tools that they need, giving them the support, the emotional support. I mean, it's a major problem. And for, most hospitals, one often underestimates the reliance that you place on the nurse. There's no doubt that, in the healthcare sector, nurses are operating under very, very challenging conditions, emotional conditions. And, then you can go even further and say, it's not just the nurses, even the doctors are operating under high amounts of stress. I just think back to the COVID days where, physicians were particularly in high demand because of the nature of COVID, having to work in a hospital environment, knowing that there's a very high chance that you could actually have got COVID. And this was even, prior to getting the vaccination. So, just taking almost a step back and trying to just look at it holistically. I think what we have to do is we have to try unpack and say, how do we better support the resources? In a company, CEOs typically talk about, how do we look after our staff? We love our staff. How do we make things easier for them? How do we enable them to do their work better? This is no different in the healthcare sector, both in the private and public healthcare sector. I think there needs to be far more attention given to saying, how do we protect these valuable assets that, that they don't burn out, that they don't want to get out of the industry, that they don't actually report sick, on a regular basis. What do we actually do to protect them? Because without them, the system doesn't function well.
Yeah, and the instinctive answer to a challenge like this is often say, well, let's just recruit more people, let's hire more people, let's relieve some of the burden. But recruitment alone won't solve the problem from what you're saying because of some of the more systemic issues behind the scenes. So what are the warning signs that people are disengaging long before they actually resign? And in South Africa, how do we, as an industry, this is everyone, the medical schemes, the hospitals, how do we rally together to help solve for this burning HR crisis, which seems to be a bit of a ticking time bomb underneath the surface? I'm not sure how many medical scheme members are even aware that it's happening.
Yeah, I mean, I'll give you an example. Many years ago, when I decided, as the CEO of the administration company to go and spend some time in the call center and actually field some calls, take some calls. And I've got to be honest, I don't even think I managed to last 5 calls because, all 5 people that I spoke to me were relatively irate, demanding, and not understanding their benefits, which you were trying to have to explain to them. Now we've got staff at different levels. Some are clinical, some are non-clinical. We're expecting them to take upwards of 50 calls a day. And many of those calls they know are going to be difficult. They're going to be screamed at. They're going to be sworn at. So it's not, as you say, just a function of, get the staffing levels right. It's how do we support them with knowledge, with the right level of training, with emotional support, with support within the wellness place. How do we pick up the early warning systems that says, we're seeing lower productivity, we're seeing someone who's demoralized, we're seeing someone who's starting to sort of disengage, detach, and how do we actually help those people so that they continue with doing the valuable work they do? And that I think is something that I would almost say applies to employees within any industry, and healthcare is no different. But maybe there's just a feeling that well, you take it for granted because it's your health that you don't really care too much about the person on the other side. And, maybe that's what we all need to do, is being a little bit more empathetic that that person on the other side is trying their best to actually do their job, to care for you or to provide you with the right information. So there's definitely a lot of obligation on the part of employer, whether it's within the state or within the private sector, setting up the enablers and the tools and the support structures to help people when they're going through tough times, making sure that you are appropriately staffed so that, if you're understaffed, people are not carrying too much of a load. And then maybe just trying to get the communication out. And, maybe one of the innovators, in a sense, is how can we better use technology? And I look at our sort of industry. How can we better use technology to better communicate and educate our members in terms of what their entitlements are to? And how can we use technology to make processes more efficient, which therefore obviously makes it easier for employees? So it's probably a whole range of things that we have to look at. But if we don't deal with it, especially in South Africa's economic times of today, where people more and more are frustrated, they're under economic hardship, and they're not willing to accept that they can't get the care that they feel they need. They become intolerant. So, what do we do? And we have to all do something to protect our employees. Otherwise, they're just going to leave and they're going to move to different industries or wherever else they can get a job.
Yeah, and in all of that, there is a certain degree of responsibility that does rest with the member. And, it's not about apportioning blame, but I think we've all got to understand that in every profession, in every area of life, we're all under an immense amount of pressure. And I was chatting to your Chief Medical Officer, Wayne Ryback, about the fact that schemes are looking to innovate, find new channels to communicate with members, communicate their benefits, to ensure that they educate members. There's this ongoing drive for member education. But if you're not responding to the messages, if you're not opening the email, if you're not reading your benefit statements and familiarizing yourself with the basics of the scheme, then I think you as a member are also not fulfilling your end of the bargain. So I agree with you. I think we've all got to bring our little piece of the puzzle, so to speak. I do think broadly, though, Kevin, if you zoom out at certainly in the public sector and parts of the private sector, if you're a nurse or working in the healthcare industry, it's a vocation for many people. I've been in hospitals where the nurses have been working under very trying conditions, but they do the most incredible job. And I chat to them about it, and I say, what keeps you here? And they say, well, we just love what we do. It is a real vocation. Do you think that sometimes that leads organizations to take that workforce for granted, almost assuming that that commitment will compensate for poor working conditions?
There's no doubt. And I mean, I think it's a leadership failure, so if you look at, in my opinion, I think especially in the public sector, there is weak leadership at the top. And I think it's a key aspect that has to be addressed, not just around the staffing and the nurses, but just in general, the entire state of the public health sector and the running of hospitals, etc. But there's no doubt that for many people it is a vocation. And you think and you hear the stories, and you talk to nurses who have been doing it for 20 years under incredibly difficult circumstances, where you would look and say, with what the infrastructure is like, falling apart, no linen, no canteen, nowhere to go get anything, shortage of stock. How do these people continue with a smile on their face to continue render services, under such difficult circumstances, and they're dealing again with very, very sick people. So I must say that maybe we all take them for granted, and we should actually applaud them, take our hats off and salute them and thank them for the work they're doing, because without them, the whole infrastructure fails. And, it becomes often then an issue of actually life and death. So we can't underestimate, we say people are our most valuable assets. And I think that applies really, really strongly in the healthcare environment. And we all need to look at ourselves and say, how can we do more? How can we better stop taking our staff for granted, better understand the challenges that they're facing? And it's up to us as the leaders to address the problems at all the different levels. And, we've just touched on just a couple of them.
Yeah, Kevin Aron, Principal Officer at Medshield Medical Scheme. Thank you so much for reminding us that these healthcare debates that we have are often not sustained by policy documents or things like, are we going to be able to fund the NHI or technology? They actually are it's people. They're sustained by the men and women, the doctors, the call center agents, the nurses, and everyone in administration and beyond. And if those people are burning out, the system is sending us a very clear warning. Thanks so much for sharing your time with us here on Business Talk.
Thanks, Michael. Thanks very much.